Hi guys, this is Jen. Sorry, I know you haven't seen me in a while. It's been a busy semester at Bryant Stratton. I I'm doing well in my classes. I just wanted to give you an update. I This semester I'm taking OB and peds. So that's basically like labor and delivery and pediatrics. That's all in one class. And then I'm taking psych or psychology. That's my other class. And I have B's in both classes, so I'm doing okay. Um, Everything's going well. Classes are going well. Next semester starts in about 4 weeks. So we had to give our preferences for our internship, where we want to do our internship, and I picked my top 3 places, which would be first I picked med surg as my top pick, and then I picked critical care or ICU for my second pick. And my third pick was mental health. So hopefully I get med surge, and hopefully it'll be in a HCA facility. That's the hospitals that's in my area that I really like, HCA. So hopefully I get to go to a HCA facility and do med surge for my clinical. And let's see. Well, some things that are different this semester here at Bryant Stratton is we have these tests called proctors. So on top of doing your regular tests and we have 3 in both classes. We have 3 tests or exams, they call them, in our classes, and then we have a final exam. So it's about 4 tests. But on top of that, with ATI, we have proctors. So that's another test. In OB and peds, there's 2 proctors. There's a mother-baby proctor, and then there's a pediatric proctor. I passed my mother-baby proctor with the 80%. So there's different levels you could test on with the proctors. And there's 1, 2, and 3. And you have to get at least a level 2 to continue on. So I tested at a level 2. And that was at 80%. A level 3, I think, is 100%. So most people test at a level 2. I only know a couple of people, I wouldn't say a few, a couple of people who tested at a level 1 and they have to retake the test. And when you retake the test, you have to get like an exam report from the first proctor you took. And it tells you what you need to go back and study. So you have to write 3 bullet points from studying on each subject that you got wrong. And once you do that, you have to handwrite that also. Once you do that, you'll be allowed to retake the proctor. So that's something different, because before you could make a level 1, but now you can't make a level 1. You have to make at least a level 2 to continue on. And I do know somebody who got a level 1, retook the proctor and got a level 1 again. He only missed it by 1 point. So I don't know what's going to happen to him. He might have to repeat the semester. So I don't know. I don't like that, because you could do everything right in the class with passing your tests and your quizzes and have a passing grade, but because you don't pass these proctors, you can't continue on. And I think the school has a lot of ways of weeding out people. They said the whole proctor thing is because a lot of people who are testing at a level 1 weren't passing their state boards to get their RN license, so they weren't even passing their licensing tests. And the school cares a lot about the passing rate because the school has a pretty high passing rate at Bryant Stratton for the state boards. I think it's like 98%. And I think in the past year it's dropped down to a 97. And they didn't like that, so they decided to make changes with the whole proctor situation because they only want people who are testing at a level 2 to take this their NCLEX or their state boards, because people who make at least a level 2 will pass their state boards, and that would keep the school's pass rate up. And the school has lost accreditation before. I think it was like 4 or 5 years ago, and they don't want that to happen again. So they're becoming more strict with testing and passing grades and things like that. So that's just something to keep in mind if you're thinking about going to the school. And that's why it's important to make sure you have time to study. I actually changed my hours at work. So I went from working 40 hours a week to working 32 hours a week. So instead of working Monday through Friday, now I work Tuesday through Friday. So I have Mondays off. And I basically just use that time to study and worry about class and because our school has to go to the hospital and for me on Saturdays and Sundays for the next couple of weeks, that gives me time to rest and recuperate. And get ready for the work week and my classes. And that's really important because this semester has been the most taxing semester so far. We have 2 pretty challenging classes, psych and OB and P's. They're very challenging classes. There's a lot of studying involved. The teacher for OB and P's, she is excellent. She gives us these videos to watch and listen to where she basically goes over the lesson again, even though she does a lecture in class during the week. She basically sums everything up again in these video lectures, which is very helpful. And I think helped me get a really good grade on the first exam. I got an 83% on the first exam. And I think that's because of the video lecture. I kept listening to it and listening to it until it sunk in and I knew everything that she said on the video lecture. And I just held that in the back of my mind when I went to take my first exam, and that helped me get a good grade on the first exam. And she's just such an understanding teacher. Like, if we need to turn things in late, she understands that. She says things like, I've been a student before, I understand. So she's just such an excellent teacher. Our psych teacher, so far, she's been a very challenging teacher to have. She creates a lot more work for us I think they're necessary. Like, we have our homework with her, and then she has a classwork and a quiz. So that's all due every week. And she actually changed the way she does her quizzes. It used to be you could take your quiz or your test in the beginning of class and get it out of the way. But now she saves the quiz until the end of class. And it's normally like a couple of questions, like 3 or 4 questions on the quiz. It's like, why create this extra work for us for a 3 or 4 question quiz? It just seems unnecessary. And she's just a complete opposite of our OBP's teacher. Like, this psych teacher is like kind of all over the place. Like mentally, like she's just a little scatterbrained, and I don't like calling people names, but she just always seems frazzled and stressed, and when you're learning something difficult, you kind of don't want somebody who has all that anxiety. It's almost infectious to the students. And so that's kind of annoying to have a teacher like that. And but our everything else is going pretty well. I do have a Karen in our class who's pretty annoying. She seems pretty focused on me for some reason. She's a much older lady. She's a LPN too, like me. And she does little things that get under my skin. I actually had to tell her off professionally this week. Like, I was sitting, my feet started hurting because we were standing so long. So I sat down, and immediately she came over to me and she leaned over and whispered in my ear. I think she was sitting there. I think she wants to sit back down. I said, oh, excuse me. And I stood up and somebody sat down. The next week, the same thing happened. I sat down because my feet were hurting, and she came over to me again, leaned over, whispered in my ear, I think she wants to sit down. And I was like, wow, again? And I stood up and I looked around for the person who wanted to sit down, and I didn't see anybody. And I'm like, okay, she's being really annoying. And then this past weekend, the other day on Saturday, I've been having problems with my allergies for the last week. I didn't know what I had because it was just hitting me so hard. I went to the ER on Thursday, and I got tested for everything. I got tested for COVID. I got tested for the flu. I got tested for strep throat, and I was negative for everything. And so when I went to the site, and oh yeah, and the doctor told me, you have a post-nasal drip. You have some, mucus draining down the back of your throat. I think it's allergies. And my eyes were watery and my nose was running. So I was like, yeah, she's probably right. It's probably allergies. And when we got to the site on Saturday, I sneezed and I blew my nose, and this same older lady in my class came over to me. She said, oh my gosh, are you sick? I said, oh, it's just my sinuses. I said, my sinuses are just draining. And I walked away, and at the end of the day, she came up to me and she said, "Oh, I hope you feel better." I said, "Oh, thanks." And she said, "Yeah, and maybe tomorrow, you should consider wearing a mask so you don't spread your germs." And I said, "Excuse me, but I went to the ER the other day. They tested me for COVID and the flu. And while I'm telling her this, she puts her finger to her mouth and goes, 'Shh, the teacher's talking.'" And she points to the teacher. And I'm like, "Weren't you just telling me about my germs? And now you're telling me to be quiet? If you could talk, why can't I talk?" And I said, "And I got tested for the flu and COVID and strep throat. I'm not contagious. It's just allergies. But thank you for your concern." And she's still holding her finger up to her mouth, telling me to be quiet. And I was like, okay. And I went home and I told my mom what I've been dealing with this older student in my class. And she said, "Oh, you need to stay away from her. She could be trouble." I said, "Yeah, that's what I'm going to do." And I said, I looked around, even though she was being annoying and being a Karen, I was like, I don't want people to think I am contagious. I'm going to look around and put on a mask, even though it was the end of the day. And I was like, I didn't see not one mask on that floor. And, but there was no mask. And my mom was like, "Oh, I have some." And she gave me a mask. And the next morning I woke up and my nose wasn't running. I wasn't sneezing. My eyes weren't watering. So I was like, "Oh, I guess the allergy problem is going away." So we went to the next site. And I had no problems with her until like towards lunchtime. And we were passing out snacks, and I had some papers that I was writing information from the charts on, and it didn't have any patient personal identifiable information like their name, their room number, nothing like that. It was basically like 30-year-old black male, history of depression, angry today. It said something like that. And I couldn't hold the papers and pass out snacks, so I set the papers down on the counter so I could still see them, make sure nobody picked them up. And she walks over while I'm passing over snacks, and she looks at and reads my paper, and she picks it up. She said, "You should not sit this down. Here you go." And I said, "Yeah, I'm passing out snacks. I can't hold the papers." I said, "I could see them. Nobody's going to bother them." And I put the papers down again, this time closer to me. And I'm like, "Nobody's going to bother it, okay?" And she walks away. And then when we go into the kitchen, she says, "Yeah, I want you to sit your papers down on top of mine." I said, "No, thank you. The papers are okay. Nobody's going to bother them. I'm holding them." And I went out to my other classmate, one of my male classmates, and I told him what I was dealing with this older classmate being bossy and being so hyper focused on me. And he said, "Yeah, I don't know what's wrong with her. I've heard some other students complaining about her doing stuff like this to them too." And I'm like, "Oh, it's not just me." Because I thought she was just so hyper focused on me. But I don't know if she's just trying to be the mom of the group and mother us. But we don't need to be mothered. Like, we're all students here. You're a student. I'm a student. You're not in charge. You're not a teacher. You're a student just like us. So you don't need to be telling us what to do, bossing us around, or trying to mother us. So I'm thinking about what I'm going to do. If next week when we go to the site and she's still keeping up this behavior, I'm going to talk to my teacher about it, to talk to her, because it's getting out of hand. It's really annoying. And, you know, you're there to learn. I'm there to learn. Like, I don't need this Karen causing all this trouble and being annoying while I'm trying to learn and have my experience with the school. And but that's the only annoying thing this semester. Everything else has been going fine besides my psych teacher. We only have 4 more weeks left of the semester until we go into next semester, and next semester is our final semester. Hopefully everything will go all right, and I can finish up school in December and then take my NCLEX probably early next year, and be done with school. I'm looking forward to that. But I just wanted to give you guys an update. Hope this wasn't too long of a video. How things are going. I wish I could do videos more often, but I kind of have to get myself into a headspace to do these videos. And I was just studying, and I had to put down my iPad to stop studying to make the video. And I really don't stop studying for anything other than working and doing housework and eating. It's either I'm studying, working, sleeping, or eating, or doing housework. That's all my life has been these last few months. But I just wanted to give you an update on nursing school, tell you how it's going. Thank you for watching, and when the semester is over, I'll come back and tell you how my final grades are and how things are going with my internship, and I'll tell you where the school placed me. And I'll let you know how things are going. Thank you for watching. Bye.